The aim of pre-admission is to basically get an understanding of where the patient is medically and also allow the patient to prepare for their hospital admission.
It was good to be able to go online to pre-book my phone call to be admitted to the hospital. It made things a lot easier to be able to get the call at a time that suited me when it was nice and quiet, to be able to go through any questions or queries that I had.
If you're booked for an appointment, you may come in as a walk-in patient, or you may get a telephone admission over the phone.
The nurse asked me if I was prepared for hospital and if I needed anything, and what to eat and when not to eat or drink.
We get the details of what they've had done in the past, what medications they're on, and the patient gets a run through of what their experience is going to be like on the day of their surgery.
For my pre-admission, I came into the hospital. It gave me some assurance talking to a person.
Sometimes it is a requirement that we do a walk-in appointment, and that may just be because we have a few more tests that we need to do within the appointment, like ECGs or blood tests.
You can book in online, so I chose a time that was suitable for me.
If you're concerned about your appointments and coming into a hospital, it may be the first time, please write down yourself a list of questions that you can bring in, and we'll answer as we go through your histories.
I was able to ask questions and get some responses to what was likely to happen after the operation, recovery and whatever. And so I found it much easier.
It helps alleviate a lot of anxiety, especially if it's been your first admission to hospital. To be prepared for your pre-admission appointment, it's ideal to have your medical history and surgical history available. If you can also bring in your medications to the appointment or have them beside the phone when we make the telephone call.
I think the fact that they knew more about my history than I actually did gives a lot of comfort.
Put my mind at rest and made sure I was all ready and able to go to hospital on time.